be speaking tonight about, well, you could see it in front of you, right? So, I was going to be bringing up about things to do with our health issues, men's health issues, with, men that are living with multiple sclerosis and the health issues that we have. And, it's pretty common. It really doesn't matter if you have MS or not. I mean, a lot of us just have these issues. I mean, you don't have to have an autoimmune disorder to be going through, depression or problems with your memory processing, sexual issues, fatigue during the day. I mean, a lot of people just, for one reason or another, they have all these things as well. So, Tyler, I'm going to get you started here, right? I mean, we did have good jokes for Damian, but
Damian he'll chime in, bro. I'm not even worried about it. And when he comes in, hey, the people will receive him. If you build it, he will come.
That's right. That's right. So our video producer was just going through slides really quick. You see that the program is supported by MS Views and News. This is an MS Conversations Now event. It's the MS Patients' Voices. It's a program that I had been wanting to do for many years. And then when we had to go virtual, well, it became a perfect time to do this. And today's type of program, we did it in 2020. It was me, Tyler, and Damian. And then we did it early this year and now again. And, the idea is try to get more men online listening to this program. All right. And, I hope to be able to do this like quarterly with these two guys. But first, we got to get these two guys both to be able to get online at the same time. All right. And so anyway, we were gonna bring up things. I wanted to speak about depression with Tyler and Damian. And obviously, Damian can't do this right now, but let's talk about it with Tyler. So, Tyler, tell me what you go through.
I think for me, I'll pick up on something as simple as what I've been going through over the past couple of years with my MS diagnosis. That, frankly, it's never gone anywhere. Stu, I think for me, when you struggle with knowing that you can't do what you once did. I think at times that was once a very much struggle for me, coming from somebody who was an athlete, and knowing that my body doesn't even walk the same, and there's that physical struggle of what you once were to where you are now. And I think I would put way more pressure on myself, not understanding that with MS, my life was starting to go on a different journey. Oftentimes, you're in the barbershop and you hear those people come in and they used to talk about what they used to do in high school and all the shoulda, coulda, wouldas. And I was putting myself in that category. And at times you have to understand that you're in a different season. And I think that's what I had to start understanding, Stu, is that athletic part, that was a season of my life. And it was a season for a number of years. Don't get me wrong. Athletically, that's what it was. But also now I'm entering in this new season with MS. But that didn't mean that everything about me had to die. And that took me some years. And I want to give people, give yourself some grace. I had to learn to do that, Stu. This was not over the night. I had to learn to give my life some grace, knowing that I am not what I once was.
Sure. So when you were approaching football season, when you weren't playing, what did you do to keep your mind occupied on something else?
For me, I think that's where my love for horseback riding came to fruition. And see, here's the deal. I hadn't ridden a horse, Stu, in about 6 or 7 years before I started, because I was away. I was in college. I was away from home. You don't exactly just put a horse on a plane and let it travel with you when you go to school.
You could.
So when I got back, I had no idea that hippotherapy was a real thing.
Sure.
When I got back home and when I was in a wheelchair and when I finally got through enough physical therapy to try to get abdominally strong, and I had a cousin who was able to help harness me and get me saddled in. That's what I started doing every weekend. While football games were going on, I discovered nature. I discovered some new things, being out in the open and smelling fresh air and making a new friend in and of a horse who did not care about what I had, MS. It didn't care how my limbs were feeling, didn't care that it was tough for me to get dressed and put my clothes on. Didn't care that I had speech impediment issues. Didn't care about the right-sided weakness on my body. Just wanted to know if I would treat it right. And I got lost in that. And before I knew it, Stu, I'm riding horses literally every weekend. And guess what? The blood circulation started to pick up in my lower limbs because of hippotherapy. The neurons were firing in my brain about other things. So a companion of a horse, it changed my life.
Right. By the way, if you want to get a horse on the plane, you can get a Shetland pony on the plane.
Oh,
I've seen some big dogs on the plane, so why can't you bring a little Shetland pony on the plane?
hey, I don't ride no Shetland ponies, buddy. I'm 6'1", Stu. I'm not fitting on no pony. I gotta have a big boy horse.
You could lay down. You can be good friends with that pony. All right.
But yeah, we're talking about sad times. That literally a companion.
That's
an
right.
Animal. So if you don't have a horse, there's nothing wrong with a dog, a cat, pet, and getting lost into something that does not judge you because of how you physically look.
That's right.
That's what set me free.
So for anybody that just came on late, I just want to let you know that Damian Washington was hopefully we'll be able to get online. He had some technical issues, and so you're looking at me, Stuart Schlossman, and you're looking at Tyler Campbell, and we've done this many times in different programs, and the three of us gel very well together, and we were hoping to be able to bring you a night of a lot of interesting things and a little bit of comedy at the same time.
Yeah.
All right, we'll try to do all that anyway. We don't need Damian for that.
We're still gonna do it, Stu. We still gonna do it.
That's right. So let me let you know, like me, with regard to the depression, I still have my bouts with it. I do not want to do medication. I bury myself in work when I have this. So especially now, also, since not being able to travel, I feel like terrible. 2019, I was on the road 162 nights. All right, doing these MS educational programs from coast to coast. Last year, I think I was on a plane 3 times, and that was all before COVID, and actually once during COVID. Oh, look who's here! He's getting back online.
Good evening, everyone. I think.
All right, everybody. This is Damian Washington, and he's back.
Yeah, apparently the internet was fine up until 10 minutes before everyone came.
That's why you need to move to Texas.
I wonder if it has anything to do with all the fires out there.
Who knows? All I know is I'm glad to be here and in this space right now with you all. Right. Thank you.
So, Damian, you came in at a good time. All right, we're talking about depression. I know this. Especially you, when you can't get on the internet, you can get very depressed. So.
I know that's very telling, because again, especially when things aren't going your way and you don't have any control over that, and you did everything that you were supposed to do to not be depressed, to feel good, but it's still an issue. And me personally, I deal with the ebbs and the flows of it all, and I just know that I am the person who hears my thoughts, not my thoughts. So I aim to be as still as I can and let my thoughts pass through as smooth as I can, and aim to keep thoughts of more joy and expansion in my world and life. Because specifically when you're at work a half hour on time early, and then 10 minutes before the curtain goes up, everything goes wrong. And
right.
That's just one small example of things that don't even have to do with multiple sclerosis, that are part of your life, that will get you down, and then your knees hurts, and then you can't see, and it's just personal.
Right, so let me let the audience know that Damian, for those who have never seen him online with me and Tyler before, Damian is he's an actor. Doesn't he look like one? He's an actor, and you never know when he's really acting or just being Damian. All right, so
that's the thing. I'm always myself anyway. My job is to be myself in the author's given circumstances. So
all right, but the three of us have, like I said, we've got this thing going where we do these programs like quarterly, and sometimes the internet works for us, and sometimes it doesn't.
Bro.
And we're just going to do it now. Now, let me let you all know also. In the past, every time I asked a question, I always let like Tyler go first, and by the time Damian got to ask to him to do the question, he didn't remember anything.
I remember.
Which takes me into the next subject: memory, cognitive issues. All right, and processing speeds. And you know what? We're going to let Damian answer this first,
Please.
so that way he could actually remember what I'm talking about. And then Tyler's great because Tyler makes notes like I do. I make notes the whole time. I usually see Tyler scribbling and making notes as well, but he's not doing that. Ah, there he goes. Okay, there he goes. All right. So, Damian, I want you to tell me, or tell us rather, what do you find bad about your memory issues, your cognitive issues, your processing speeds and whatnot, and how do you make up for it, or how do you battle it?
All of that stuff, processing speed, memory itself, recall, like it's tied to fatigue in me. So I know that if I'm having a fuzzy time understanding something that I usually understand, or people's conversations, like I know that I need to unplug. Like maybe I need to go meditate for 15 minutes. Maybe I need to do some Qigong and figure it out, because right now the brain and the spine are not cooperating right now. And I aim to stay as close to the line of in the middle as I can. But when life like messes with the Wi-Fi, and so it kind of wants to pull you to another side, you aim to just stay in the middle and aim to take care of it and be present. And that's how I deal with the depression. It don't go away. I just kind of like invite it in and be like, hey, how you doing, buddy? And the more that you give presence to this thing, the more that it kind of doesn't really want to stick around as much, because part of its power is you trying to make it go away, if that makes any sense.
Yes, it does. Of course,
I think that's deep. That's deep, D. Because what he's really telling everybody is that it's not the depression that's necessarily the one that gets us. It's the way that we handle or the way that we cope with it, because it never truly gets rid of. So it's our coping mechanisms and how we choose to adjust to them. Those are the things that constantly get on that cycle of repeat, which ultimately either bring us down, or it's kind of like the constant balancing act of being unbalanced in life,
Ultimately, I'm sorry, to piggyback on that, that's what I'm saying. Like, you are not your thoughts. You are the thinker of the thoughts. So if the thoughts are not that sweet, that's cool. Just write it out. Eventually, they're gonna not want to be in there anymore, and you have more uplifting, more supportive thoughts to keep you moving forward. It might seem pat, but that's real.
All you need is one positive thought, Stu, and you can think of the same positive thought the rest of the day. I don't care. Same thing. Just one.
Feel good. Just chew on it.
Yeah, because the negatives can outweigh the positives. More than likely, they will.
What are you talking about? I forgot already.
Come on. Loosen that V-neck shirt. Loosen that V-neck shirt a little bit more.
There you go.
Go ahead, Stu. Keep us online. Stu keeps us on track.
So again, for the people out there, I forgot to mention it earlier, but we weren't going to take any questions tonight. But if anybody has any questions that you want to ask either or all of us, okay, there's the orange rectangle at the top of the screen. You just click on that and type in your question, and I'll get to it hopefully, because I forget to look at it, on programs like this. So. We'll get to it. Now, I have one person that just wrote in that, she feels that all three of us are very accomplished in our own way, and I think there's a question there. Has your MS diagnosis increased your own drive? So, Tyler first.
I will say yes, and I'll say this because we are all a best written novel that is yet to be discovered or published, if you haven't noticed that in and of itself. Every person on this line and every person listening, and Stuart and Damian, we have a story. MS is a part of my story. And there are other MS patients. There are family members of MS patients. There are young children whose parents have MS. And the more that I feel like my story is out there. The more that we openly discuss these tougher topics, it broadens the reach or gives further hope or help to somebody who's in need. Those are the stories that I'm going to be looking for. So my MS is my activism. You know, a lot of times people are trying to find how can they be active. MS is my activism. And I think that's what has pushed me to where I am. I'm not meeting Stuart and I'm not meeting Damian if it weren't for MS. And I have two great friends now. Does that make sense?
Thank you.
Wow.
Thank you. I appreciate that. I'll appreciate it even more when you get me out there and go horseback riding.
D, listen, yeah, I will do that. That's not a problem. D, what are your thoughts on that, man? Because I know, I know you've been on this road with MS too. You know, you've been on this journey for a while now.
Yeah, I'm a naturally driven person, an extremely driven person. And I think what MS has specifically done is it's given me permission to take my foot off the gas pedal. It's given me a structure with which to be like, you know what, bro, you're not thinking clearly, or like, no, you can't walk like you want to. So stop trying, sit down, time out, close your eyes, meditate, like do something to sort of bring you back and don't push through. So ultimately, it's increased my drive and yet has also applied a brake of sort that I did not have for myself prior.
Wow. So you got so you have your stop sign now.
Yeah,
so
absolutely.
MS also provided you with the stop sign now. Yo, that's powerful.
It gave me
you care to know about me?
Yeah.
So, I never really cared to be involved and really make people like understand something. And this gave me the desire to teach. And I never thought I would be a teacher.
Wow.
All right. Now, to let you know something better, I was an advocate for one of the pharmaceuticals. I'm not going to say which, many years ago, for a medication that I was using. And I would always sum up my talks with, I was once known as a very arrogant, abrasive, obnoxious salesman. And these days, you could just know me as a very arrogant, abrasive, obnoxious humanitarian.
Yeah.
Right. But the bottom line is I get myself very involved with trying to provide for all those that are just not learning what's wrong with them, and how to find coping mechanisms. Whether it's about one of these symptoms that we're talking about, or it's about the disease itself. I mean, look at COVID. I mean, when COVID began, 90% of the MS community thought that they were in deep doo-doo, okay, because they all thought that they were immune compromised, all right, and like an HIV patient, and it's not the case. And why is that not the case? Well, they didn't know that they have an overactive immune system. And that's something that I and the doctors had to get online and be telling them every single month at the beginning, to educate them. And so why were they never taught that when they were first diagnosed? Okay, except if you're using an immune compromising medication, then you're not immune compromised. So, we can fare better being in a room with people that have colds or maybe sick. I can't say that everybody's like that, but I know that over the years, I've always been able to be around family members that was sick one way or another and not come out of it sick because my immune system was always running hyperactive. And people just didn't get it. So, that's one of the things that we had to teach them. But just in general, going back again, just teaching them about the medications, teaching them about the symptoms, talking about like a program like we're doing tonight. This became very empowering for me to do. And that's why we do it. Go ahead.
Piggyback off that too, it drives me. Like, I know that no matter what, like I haven't been on my vlog lately, unfortunately. I know no matter what, there are thousands of people who want to see what I have to say about my MS or life with MS this week, this Wednesday. And without that, not external purpose, but without that sort of medium, I would have to channel my energy elsewhere and do other things. So as much energy as MS takes away from me, it gives me space to be able to pause so that when I do have any energy, man, I'm taking care of y'all. Man, I'm talking to y'all. because I know what it is, and it's not cool.
Right.
It's not good at all.
That's real.
Yeah.
That's real.
That's why I like you doing that MSViews Now program too.
That's why
it's great. It's great.
I love. Thank you. Thank you for letting us. Because
Damian works with MSViews on a program the opposite of what I do with MSViews Now. And Damian interviews patient advocates while I interview the clinicians, for that. And whereas Damian's talking about their talking points and their positiveness that they're giving back to the MS community, I'm speaking with the doctors or the nurse practitioners or whomever else about things to do with COVID and something else to do with multiple sclerosis. And we're going to get Tyler in on this too, because, this would be great to get him on board as well. All right. So let me go on to the next thing. All right. I think you were talking about cognitive issues a few minutes ago. I don't remember, were you?
Look at you, Stu. Look at you. You're right on time.
That's right. That's right. That's right. Okay. What's next? Let's talk about daily endurance. And you mentioned fatigue before. Let's talk about your endurance, your longevity, your getting things done throughout the day. Tyler, what do you got to say? What helps you get through the whole day? Staying focused? Do you make notes? Do you have a chart? Do you do it like a playbook that you're running a draw play or something?
No, it's I'm using technology to my advantage. For somebody who was already not the most organized individual, guess what? It got worse with MS, and as I've gotten older, it gets worse. So I need help. I think it was the awareness for me to understand that, with this disease, you have technology available. You have a calendar on your phone. There are ways of implementing things to serve as reminders. Use those things. Stop being so prideful and thinking that you can always do this. Like, the stuff is here to help you. And so you talked about cognitive stuff and remembering. We've got all these Zoom logins. Everything's virtual. All the calendar events. So for me, I had to learn how to be more organized and not get stressed out about it. Instead, use what we have with all this technology of computers and your phones to allow yourself to be greater organized. And so I'm using what I have, and it has helped me out tremendously. I think I wake up early. I'm an early riser. Why am I an early riser, Stu? Because some days I don't sleep that great. Can I get an amen on that?
Can I get an amen?
There are some days with this disease where your mind is my mind is racing, and I don't know why. But I also know that my body is on a time clock. My afternoon Tyler Campbell and evening Tyler Campbell is different than AM Tyler Campbell when everything's firing and everything is rolling. So I play to that, and I try to do as much stuff as I can within my being in the AM and earlier hours and pace off as the afternoon comes. So my days are different in years now with MS than they were in the past to try to help me out. So it's being smart and being aware and utilizing the amazing tools of technology that we have to help us and not be so prideful that you don't use them. So AMTC, Stu and Damian, very different. And so if you know me, you know that I do a lot of my speaking stuff in the AM. I do a lot of the meetings that I can in the AM. And if I have something on the evening, that means my morning is slower paced to spring up more greater energy for things like this in the evening. So
you don't have chickens there, do you? You don't have chickens there, do you?
No chickens here for me. No,
well, I thought maybe that was waking you up. No. Before I let Damian speak, there are things that when I'm sleeping, I'm already thinking of how I have to do that in the morning. All right. And so I don't sleep well. I mean, I wake up and I just want to get my day started. But last night was horrible. My AC broke down in my home yesterday. Oh my gosh. And here it is, 90 something degrees out down here, right? And last night at 5 minutes to 1 in the morning, I said, I got to get in my car and cool down.
Yeah. Wow.
Hey, so I'm noticing though that the car is heating up. The temperature gauge in the car is going up. I said, oh man, that's because you got to be running the car for the fan to be working, right?
Yes.
So I look at my phone to see what the temperature is out. Well, it's 84 degrees, but the feels like is 94 at 1:30 in the morning.
Mm-hmm.
Now I got to go back into my house, which is 86 degrees inside, with now no AC running. So anyway, I didn't sleep last night, but I did get an hour's sleep today, and I feel totally refreshed with just an hour's sleep in the last 24 hours, and that's it. All right, and I'm totally in this game today.
Wow, brother.
Yeah, 89, what'd you say, 96 degrees? That's too many degrees. I'll tell you that right now.
Well, it is. So ours was only 94, so I feel better about being 2 degrees better than the 96.
Look, I mean, that heat especially messes with my cognition.
Absolutely, mine too.
Of
Mine
course,
too.
I use my phone and the apps on the phone. I also talk to Siri and be like, hey, Siri, remind me to do this thing at 2 o'clock.
Absolutely.
I keep a ledger, and like, you know, on the business stuff is on the top and personal stuff is on the bottom. And I'm like, what emails do I have to take care of? What do I have to do today? Like, I'm aiming to always give my mind less to do, so that if my mind is falling into some Swiss cheese hole, it's doing that less on the things that matter to me and that are important enough to write down. It's giving yourself the grace to give yourself the tools that you need now. And if you can't do it like when you were younger, you'd be like, oh, I could remember all this stuff. But it doesn't matter. Here you are now. Use your phone, ask Siri something, and get a ledger, and make sure you continue to convert on the things that are important to you.
So for everybody to know, Siri is extremely important, much better than Android devices, all right? And
Way better.
Way better, exactly, all right? And Siri talks to me even when I'm not ready for her. All of a sudden, I'm talking about something, and Siri's talking in my ear, and I'm like, Siri, shut up, all right? I'm not talking to you right now. All right? But yeah, I use the calendar invites all the time, and then people get upset with me. Why are you always doing calendar invites? Why are you doing this? Why can't you just remember? Well, guess what? I can't. All right? And I have zillions of notes, lots and lots of notes.
That's why I would say the legend's not far. Like,
That's right.
I have to small camera to get it, but it's not far.
You want to know what's weird? You know what's weird for me about that notebook of yours? I cannot use lined paper. I cannot follow anything. I have to use plain white paper that I make notes on, and I'll like scribbles, and I'll draw lines across on the paper to separate things, but I can't use a lined paper. I have to make my own lines. I have to create my own borders.
Hey, to each his own. If it works for you, it works for you. That's the whole principle. Right. I think this is our walk with MS. What works for us and what works for you don't mean it's going to work for somebody else. You just got to walk in it, man. And
just keep trying, and don't be discouraged when things do not have the results you think you would have. That's super important.
That's great. Now, I want to ask you, though, for strength during the day, are you doing anything? Are you doing exercise? Does that support your strength for during the day? Or do you have other things that you're using? Are you popping a pill? You're doing a gel? You're doing something?
Hey, go ahead. Well, listen, for me, I think my regimen hasn't changed since we started getting on here in 2020 to 2021. And so for anybody who's out there, consistency is always everything. No matter what you do, I'll tell you what I do, but it's not a matter of how much. It's not a matter of what it looks like. It's just about what is consistent to you and how often your regimen can stick. That is all it is, whatever it is. For me, it is push-ups, pull-ups, and sit-ups. That is me. Doesn't mean it's for you, but it is consistent for me, day in and day out in some form. I'm not saying I do a ton. I'm not saying it's a lot, but I will do something to get endorphins, those free energy things rolling in my mind. Consistency.
Great. All right. And Damian, what are you going to say? Because then I got something special to say.
Well, no, personally, that's why I have developed over this time a meditation and Qigong habit, so that I know that unless I have like a late night or like whatever, I know that no matter what,
I think he froze.
Did he freeze?
He froze.
I knew he was gonna go into his qigong though, brother. I always love the qi.
I think that's what it is. I think that's where he's at right now. He just wanted to show everybody the
He wanted to go
pose.
his qigong moment. Oh man.
All right. So while he's froze up, it gives me time to say something and he can't answer me back. All right. And that could be cool. All right. So there's a lot of guys out there, all right, that have a problem with endurance, fatigue, shutdown of their body, and maybe it's because of their own hormones, all right? And this has to do with a lot of guys with multiple sclerosis where and not just guys with MS, but even guys when they get above 50, all right? You just lose something from your body. And, there's an answer for that. And the answer for that is that, you really need to have your testosterone levels
checked.
All right. And what I was going to say was, for me, I've had an issue with testosterone levels since I was a youngster. Okay. I was actually around 20 years old when I found out that my levels were extremely low, dangerously low. And, I needed to get testosterone therapy. And at that time, it was injections. And it was this big ass needle right into your damn butt, man. And it hurt like hell. And it was a thick needle. It was an oily substance that had to be put in, and it was rough. But you see a lot of these muscle-bound guys that are all doing that stuff too, right?
Yeah.
But it changed over the years. It became a patch in different places of the body, and then it became a gel, which it still is. And that's what I use every single day. And people say, well, where are you getting all your energy from? Well, I think a lot of it has to do with that. It just has to do with having the right testosterone level. So, for any of the guys that are out there or any guys that are going to listen to this later on, you need to have your testosterone levels checked, all right, because it's very important. And it could just give you the extra boost of energy that you need to get through each day.
And I think that's huge, Stu, because we talk about our therapies and seeing our neuros. There's also, what about the overall annual exam so you can get an understanding of everything else working in your body and include that testosterone test within that, because with COVID, to be honest, a lot of us have not seen physicians probably as regularly because of so many other things that have gone on in the world. And so that is an appointment. If you allow that opportunity to get that virtual appointment or wherever you can get your testing done, because it is as simple as turning on a quick light, and that's what Stuart's telling you. If you can't get those annual exams. And
let me let you know, I use Quest diagnostics for all my blood work. And from the very beginning, I remember when I went to Quest at the beginning of COVID, I went there with my gloves on. I went there with all my sanitizer gel. I went there with wipes, and I had to take out my Clorox wipes and open up the door and get inside and make sure that my hands are clean and everything else. And, scared like everybody else was to touch, look, or do anything, right? But I had to go there for my blood work. And I get blood work done quarterly. Also, it's it's very important. It's very important for me to know, that my CBC levels are okay, that that everything going on in the blood, that I'm not contracting something that, that we don't want it to find out too late. So you want to find out if something's happening badly to you. It's better to find out early on than to find out when it's too late to do something about it.
That's right. That's
right. All right. So, these days is like almost a medicine for everything, almost for everything. All right. So it would be good, though, that if you can find out, if something's going different with you, that you can then look more into it rather than get yourself worse before, and then not having a cure for it. So
it's a good word, Stu. That is a good word.
So guys, go and get your blood work. It doesn't matter that you're a guy. All right. It's not going to the doctor is not just for ladies. All right. Going to the doctor is for everybody. All right. And you should really go there and get yourselves checked out. All right. And if you're over 50 and you're feeling sluggish, get your testosterone level checked. You might be really, really surprised to find out that, wow, I could actually do something to make me feel better. I might be able to, go out and enjoy the full day again. And it has nothing to do with your MS. It could have just everything to do with your testosterone level.
And it's a very quick change. And I think that's good because sometimes we get so narrow-minded and focused on our MS, as we should. But what also helps us manage our MS is managing the rest of our body. You know, if you're older, you've got the over 40 exam. You know, you have to stay on top of those things so you're not battling MS and potentially something else. But you know, but we got to stay on top of all that stuff. And you're right, Stu. Hey, the ladies go to the doctors like clockwork, and fellas, we got to get with the program. I'm telling you.
I listen to some of these women that I know, and they're saying, "Well, I got to go to the doctor. I got to go to the doctor." It's like every week they go to the doctor. And I'm like,
everybody's going to the doctor. But we can do it too, though, Stu. We can do it too.
Right. Damian, you missed all my chatter about testosterone.
We're talking about low T, D.
Oh, T.
That's what we're talking about.
I can't hear you. Got to push that button again.
That's what we
There's
want.
a lot of issues tonight.
We just trying to keep it cool when things are not cool at all.
Right.
Go
Frustration.
I hear what you're saying, but go for it.
Frustrations. So you're going through frustrations with your network tonight, right?
Hey, we got frustrations we can talk about later too. Now that leads.
Look.
Damian, look at it like this. As long as you're not running the show, then it's okay for you to bleep out like this. All right. It'd be worse if you were running the show tonight.
That is also true. I mean,
true.
you had your own set of technical difficulties too. So
that's right.
Every now and then it happens because it has to go to space and to Florida and to California and like, you know what I'm saying? So
right. Well, you saw I had the issue earlier, so you know that's why we come on. That's why we come on early and we test it all out. We make sure that things are working or not working, and that's why I had to change locations also. All right. So anyway, we were talking about Damian. We were talking about how guys don't go to the doctor enough. All right, how they don't get checkups enough, how they don't get blood work enough. And I was telling everybody that, you know, I was diagnosed with low T when I was very young in life. And, you know, with that, though, using that, I have more energy than most people. All right. And it's not that I was lacking the energy because of the MS. I was lacking the energy because I had low T. All right. So once you bring up the T, look at T, you know.
You're rolling now, Stu.
Got plenty of energy. Got plenty of energy. All right. Let's go to the next thing. This is an important topic, all right? Because we're gonna be ending here in I don't even know what time it is, but we're gonna be ending here in another 20 minutes, and we might as well get to this important topic. And we're talking about something that I know that you guys love talking about: sex, right? You guys like talking about sex. You like talking about romancing? Wait, we're going to talk about just romance? We're going to talk about just doing it. All right. I mean, you got to figure out what, you know, your lady wants. Does she want the romance? Does she just want you to just do it? Right. Okay. So, and another thing is, let's talk about it even a little bit further, right? I really don't care at this point in time, but you know, sometimes it requires you to be eating out, right? In a restaurant. Don't get that thing going in your mind there, right?
Stuart Schlossman, ladies and gentlemen. Hey.
So you know, the idea is go to a nice restaurant. Go to a nice restaurant, have a nice dinner. You know, make the evening a little bit special, all right? You know, you're talking about the intimacy. I mean, Tyler, I know you've talked about it. Damian's talked about it. You talk about pills. You talk about toys. Hey, we could talk about the testosterone gel, all right? We can talk about all these different things, and that, you know, you could talk about, you know, just having a great time that night. I'm not talking about the sexual part right now, but, you know, if you want to talk about that happy ending, oh, no, guys, I'm not talking about that either, right? I'm talking about you just having a good time that night, and that would be a very happy, nice ending of a night. All right, so T, tell me what goes on with your life with this issue.
I think, man, and it's funny because it's timely. Me and Damian just had this discussion. I think I reached out to him maybe a week or so ago, 2 weeks ago, about this same issue. For me, it's been ongoing since 2007. It's 2021. So I've been dealing with this, the erectile dysfunction issue, the quote unquote premature ejaculation issue. I have no problems talking about it since that time frame. So for me, it's been a journey. You've been through so much with low T. I've been through creams and different ways of trying to handle this. It's always been the elephant in the room. And I think the depression for me has weighed in from that thing as well. And it's in my marriage. I'm married. I have 3 kids. It's been an ongoing discussion with me and my wife together. But I want to tell people this, because we talk about, eating out, etc. Communication is so key. Your communication with your loved one, whoever that person is for you, they have to be a part of this journey, and they can only be alongside you with this journey if you communicate and let them know exactly what you are going through. If you're doing this thing solo, then that person is isolated, and they're not able to be walking alongside you with this. It takes a team, and we all know this with MS. It takes somebody else because of the stress, because of the cognitive issues, because of the pain. So for me, it's been communication with me and my wife, the good and the bad. It's trying to satisfy her needs as well as the needs that I have and how we go about navigating this monster. And it always goes to being willing to try something new, because what works for somebody, it doesn't work for somebody else. And for me, I was able to try something new because it worked for Damian. Pills came into my life with that I was able to finally try, and they worked for me. Cialis, Damian Washington, it worked for me.
You ready to go?
And so here I am. I say that to say what you talked about earlier, Damian, the depression, the stress, the weight, the coping skills. It all ties into this because I'm dealing with it since 2007. It took to 2021, August, to find a therapy that worked. So stay persistent, stay connected. But the thing that outweighs the performance and helps with all of this, because I've been married for 10 years now, is your communication about it. So fellas, we can't go in the dark and try to leave it up to our spouse, leave it up to the girlfriend, or leave it up whoever to try to just figure it out. When we're going through our dark times, we're depressed because things didn't end the way that we wanted them to. The only way somebody can help or help feel or to walk alongside us and empower us is if we communicate with them. And fellas, we don't like to talk, but you're gonna have to learn to do this.
The idea of just being more present and more communicative and more just open about, not even about that, just with yourself. And
good, D.
Having the, when you hit the wall of a limit, or like, oh, I can't do this anymore, or, oh, this is different now. That's part of the MS just showing you where your new boundary is. Mm-hmm. And you could be mad at that new boundary. You could be like, oh, I can't do that anymore. Or part of your thinking is like, what's the way that I can either go through it or aim to be present in the most way that I can now, even if the road that I usually travel is not it. Like in the bedroom, you have your Viagra, but that might not do the trick, or it's not good. Then you have Cialis, and that sure, whatever. Bottom line is, one has to be upfront and about their identity. That's what the heck I wanted to say.
There you
go.
As
a man, your identity is wrapped up in this. As a lady, your identity is wrapped up in this. And the sooner you get closer to these coping mechanisms to help with your depression, to help with the cognitive issues, to help with all the other stuff, it helps you identify with yourself differently. And it helps you tackle whatever issues that you might have with a different head, and hopefully you get a different outcome.
That's it. Boom. You see how you put a bow on that, Stu? Wow.
Somebody just asked me a question that I don't even know how I'm going to ask Damian this question, all right? But they said, Stu, you got low T and Tyler's got low ED. What is low about Damian?
Well,
man, go ahead, D. Go ahead.
At this point, from what we can see, apparently my internet connection. That is the low. That is the pits right now.
That's the pits. I think, and Stu, can you guys elaborate on this? Because I think a lot of men don't discuss it because they feel like they are alone. And can we all just say like this?
I don't know if that's it. I don't know if that's it. I think a lot of guys don't feel like they're a man if they have to divulge that.
Identity is what he was talking about. Mm-hmm.
Right?
That's true.
That that they can't come out and fess up about it. You know, that they're afraid that it's not even that. I don't know if they're afraid or if they're just they just don't want people to know that they might be less of a guy.
Mm. And that's good. And that dives deeper, right? And that's how we always talk about, like, it's not just the MS thing. There's a cycle of what a quote unquote manhood
That's right.
looks like. And it's
That's
way more than just this. You
That's
know what I'm
right.
saying? But that was maybe passed down from generation of generation of generation. And so there's a curse or a chain that has to be broken. And that's tough because you're dealing with that along with this MS monster. But that's a very good point, Stu. That is a very, very good point. And I hope there are women on here that are listening in, because you dive deeper into that quote unquote manhood thing that's misappropriated.
Right. Well, there could be women on here who are married to a guy that does not have MS, but might be in the same predicament. I mean, you know, maybe he doesn't have any energy to do anything with her. Maybe she wants him to do more in the bed or out of the bed or whatever, and that he's not being responsive. All right. And maybe this is, you know, one of the issues that maybe she could get him to go see a doctor and let him just start talking about it. But, you know, just in general, I mean, not even talking about this manhood thing or anything else. A lot of women, though, or a lot of people are just turned on by guys that can speak in front of a room. All right. In not just guys, but women too. Anybody that's a speaker. All right. People sit in the audience and they say, wow, I wish I could do that. You know, I can't get up and talk in a group of people. And so now, though, that they're could possibly do it virtually, you know, maybe they could do it from behind a screen where they don't even have to show their face. All right. And they could possibly talk about something, but then they might still be afraid, though. Oh, who's on the call that, you know, who might know me, and they're going to hear my voice and they're going to learn all about me. And I didn't want them knowing about this. And, you know, it's a big catch-22. But I think the biggest problem is, like I said, guys just have a hard time opening up, especially with other guys. I mean, they don't want anybody to know that they're either like this or like this, you know. They don't want to let them know, you know, what's going on in their head to know whether or not that, you know, they're able to function like what a guy is supposed to be. You know, are they a he-man or are they just a man?
Well, see, that's another thing too. Like ladies have like the same issue. It's not a specifically a man thing. And again, it ties back to identity. Like, I'm supposed to be able to do this, or, oh, this should be some other way. Personally, I have a significant lesion load in my spine. So that means, like, everything is different. Like, going to the restroom. Like, your entire world shifts when you have this sort of diagnosis. So if you are going to continue to apply a mindset that came before this presence of this condition, you're going to have a cognitive dissonance a lot of times and not really be able to reconcile your current self with what you know or you knew of yourself. And that's why it's important to, I aim to always do, not always, but often do the opposite. Like, if I feel like climbing up, just say something. If I feel like saying something, just climb up. Because what is part of your growth is what doing things you don't want to do. And no matter what that feels like or sounds like or what the topic is or whatever you don't want to do, that's the thing that is going to make you better, going to grow you, etc. So the sex and the intimacy and the relationships, that's another way that MS is getting you in touch with what makes you uncomfortable so you can grow from that.
I think that's big, brother. You're going to have to get used to doing, because what once worked, it's never the same again. It's just not. And sometimes you have to step outside of yourself to look within yourself, and then that's when you can only find yourself.
That's the only way that the snake grows, is that it's uncomfortable in its skin and it doesn't know anything else, but it has to flush out. And that's what we're doing with doing the thing we're scared of, doing the thing we wouldn't normally do, like speak to our partner more directly about our situation.
By the way, I don't want to take away from the seriousness of the subject, but, I have to joke around a little bit. And Damian, did you really have internet problems, or did you just have pee problems tonight?
Stuart Schlossman, ladies and gentlemen.
Stu.
Stuart Schlossman.
Hey, the shade room.
Look, man, I think it is important to recognize how much of a boulder such an issue was for me at that moment when it was go time. It's just like our topic. It's like, no, this is time to do this, but this isn't working. And so you stay calm and you figure out a way to still get the job done. And you can be your most present, effervescent self all through that. That's
And
it.
here's the deal, brother. Yeah, go ahead, Stu.
No, you first, Tyler.
I was going to say what you're going to find as nerve-wracking as what we're talking about, because it's already touching somebody's heart. Some people already know what they have to do and have known it for a long time. And what's going to blow your mind is that as you slowly start to set kind of like your heart free, as you slowly start getting a deeper understanding of you as a male or as a woman, as you get to really and truly know your true self, you're going to find out that your conversations are so straight to the point and you don't like dance around stuff or like get eerie or feel like you can have those conversations, and then it's going to become funny to you how like you can go to an uncomfortable place and you're going to watch other people get uncomfortable and you're going to be like, oh, I got them. They're shaking. They're nervous. But I'm already so confident in me that, hey, it's on you. So we're going to talk about this. I told you, D, I was in the phone. I'll listen, Stu, and I'll get to, I told Damian because he had helped me. I'm to the place now with talking about this stuff where I had a friend and his wife was in the back seat. And he was like, man, TC, how are you doing? I was like, my brother, I'm doing great. He was like, why are you doing great? I said, well, I'm going to tell you why I'm doing great. I said, because I popped some pills this week with some Cialis, and I felt like I had never, ever felt before.
You was ready to go. You was ready to go.
She's dying laughing, but he's dying laughing. But I was like, man, what's the big deal? I'm telling you these things because sooner or later, if you ever have these problems, I was telling my friend, if you ever have these problems, yo, talk to that lady in the back seat, and you guys come up with a solution that works for you all. I'm not saying you have to find pills to do it, but what I'm saying is, yo, let her in. But first and foremost, you got to get comfortable with yourself. And I'm laughing because they're nervous. They're turning red. I'm like, man, it's all good. It's all good.
Be comfortable with being
comfortable with you.
That's it.
Be comfortable with you. It has nothing to do with anybody else. This has to do with you. Don't make it about anybody.
Comfortable with being uncomfortable. That is the way you will grow. And that is the way you will have better communication with your partner to have increased intimacy, regardless of sex. You want increased intimacy in your relationship and have that be expanding. And that's the point.
That's true. That's very true. So just given a few minutes left in this, I'm not going to ask the question that I was going to ask you guys. Well, I'm going to ask it anyway. Hey, this is not a joke. This is not a joke, all right? But Tyler, when you were playing ball and you're all in your uniform and whatever, and all of a sudden you felt you had to pee, what did you do?
Hey, Stu, that's actually when there's two things. Number one, I've seen the dudes do the towel and the cup on the sideline. Number three, I always had to pee every single time before the game started. But that's actually when I ran my fastest. I held it.
I'm sure.
And then it went away.
Yeah. So now I'm going to ask, Damian's cracking up there. Damian, you're on the set. You're getting ready to make a movie or an advertisement for TV, and all of a sudden you feel like you got to go. What'd you do with it?
It depends on what the situation is.
You used the key word. You said depends.
Stuart Schlossman, ladies and gentlemen. Hey. No, really though, especially when I'm on a set and it's a high pressure situation and thousands of dollars are on the line, I certainly aim to keep a close eye on my symptoms and give the things that I need to keep going, like the proper food and the proper things to keep me propped up. And if it comes to bathroom, well, we just know that talent's gonna have to go. And this is how often talent goes to the bathroom.
Take me for who I am.
I brought 2 bottles of water here with me today, but I haven't drank any of them because I don't want to have to go. All right.
Hey, so self-awareness, you got to know who you are.
When I do my road trips, I know no coffee because I don't want to have to stop 20 times to go an hour away, you know?
I'll tell you
So
this though. On that note, there are there's not the squatty potty, but the porta john. There are certainly that's one brand, but there are totally things that you can get to put in your car, and
that's
when
right.
you have to like go, it's like
That's right.
I'm gonna pull over and pee in this bag, and the peeing in this bag is better than peeing on myself and all over the interior of my vehicle.
Yeah,
So
but for
I'm
me,
telling you.
I would need a tent. For me, I would need a tent because
Hey.
I can't just go on the side of the road. I got like this road fear, right, about peeing on the side of a road. So I would have to take out the porta john and throw a canopy over it.
I know exactly what you're speaking about, sir, and I can only tell you with experience, confidently, no one's looking in your back seat. So you and the idea of most of the stuff that's in here that's stopping you from actually peeing, like I get it, because like when I'm like it's time to go, but my body's like no, I can't go, and I'm like bro, I have my thing in the bag ready to go, and because I gotta pee, what's going on? We all have something that's in front of us. That's unimportant. What is important is how you go around it and how you get around it. And that's the most important thing to keep in front of you, that you do not let the thing, whatever it is, stop you from your progress and stop you from it.
That's why it's also a good idea to have a car with 4 doors, because you could always go between 2 of them.
Between 2 doors. I know what you're saying.
That's what I'm saying. Like there's ways that the humans are so resilient and also so like downtrodden at the same time. And it's easier to feel downtrodden when you hurt or you can't see or you can't walk, etc. And that's personally why I take the time to make sure I meditate, to make sure I qigong, because I'm more than anything else, I'm used to just hearing this mind jibber jabber about anything and nothing at all. And I'm used to letting it do that while I just sit there, unfazed. And I'm practiced in it. So when it's the silly things pop up during the day that my MS has limited or etc., I'm used to just listening to it and then doing something else.
Never forget you have the power of choice. You have a choice. Nobody will ever take your choice away.
You're the person who hears your thoughts. You are not the thoughts.
I got to back up. We just got a question in about this whole intimacy thing again. And, you guys were talking about, being married, all right, and talking with your other half. And the question is, what if you're only dating and not in a serious relationship? How do you get into those subjects?
Go ahead, D. Go ahead. You have to realize that if the person is for you, they'll be there for you and understand. That's the one thing. If the person is for you, and if they're not, they won't be. My wife was once somebody I dated, and I had been dealing with the whole this monster in my room for 2 years at that particular time. By the time we met, so I was 2 years in with erectile dysfunction stuff. So this stuff didn't just spring up and happen. This was a woman I dated, newly dated, and I told her, I said, you know what? I'm falling in love with you, and we hadn't got sexually intimate. I said, I'm falling in love with you, but I need you to know something. And I respect you so much as a woman, and I admire you as a human being, that I just want to be upfront and honest with you, and I don't want to waste your time.
Most guys aren't like that. Most guys aren't like that.
But it took years. It took a few years for me to get there. It took a few years of me working to get there. That's what I want to let people know. And and this is me in my early 20s. This isn't me in my 30s. This is me in my early 20s. But I walked that walk to where I just wanted people's honesty with me. Like, I didn't want doctors beating around the bush with me about my MS. I didn't want my physical therapist beating around the bush. Like, give it to me straight. Please, no more lies. All right, this is my disease. So I had gotten to that point personally for myself with this disease. And I literally, if I love this person and if they weren't for me, the man up above will supply me, or life will bring me that person, or they might not. And I just had to live with it. And that's not easy to do. So you have to, again, get to that place for yourself. but I love this person that much that I just wanted to see that person happy. And that's why I had that conversation.
There's a lot of times, though, that they have these things brought up at conferences with doctors speaking, and the doctor's always telling the MS patient, you don't have to tell anybody until you're absolutely sure that that's the person you want to be with. So what you were saying, Tyler, is exactly that, but coming from an MS patient, it sounds a lot different than hearing a doctor who doesn't know to be able to talk about it, rather than them just speaking clinically about it. So, thank you for bringing that up.
No problem. D, you got something?
Man, what it is that I just be listening to Tyler and forget what the
No,
question.
D, we were talking about if you're in a relationship with somebody or somebody you really, really care about, how do you go about, explaining this, this stuff? If you're just dating, just dating. Yeah, just dating.
Look, and specifically this, if you're just dating somebody, it depends like how many dates. And one, two, if we're of the dating level, like, oh, okay, are we the type of dates where I'm gonna boom boom shake the room and I'm probably gonna see you maybe 6-7 times if we're lucky, or is this somebody who like maybe I might spend the rest of my life with, or you don't know. And when you don't know, it's best to be as prepared as you possibly can. So if you have this is about getting in touch with yourself.
It's all gonna go back to that. Go, D.
And if you know that, this don't work the way it should. However, I'm going to make sure I have something in my back pocket that just in case it might, I can just have this right here ready to go. And we'll cross that bridge when we get there. A lot of times folks sort of put the cart before the horse, and they act a certain way when they want something in that arena with another person. And it's like, yo, bro, just be here with this person. You don't even know if that's going to happen. So don't even think about that. Think about being here with this person. But again, if you're dating, just have whatever you need to go, ready to go. And that will be the main way to and cross the bridges when you get there.
That's it.
Things might just spring up.
They might.
Hey, Stuart Schlossman, you're free
coming on in, springing up. Look at this guy, man.
Well, Tyler's talking about the monster before, but then he's talking about ED. I mean, it's hard to understand where all that was coming from.
Hey, I think I'm so glad that person asked that question, though. I really am, because what Damian was really saying was like, yo, you guard your heart and you gauge it off of how you're feeling and what you know about yourself, what your emotions are, and what you're feeling about this person, and actually letting your heart speak to you in a way that, hey, a doctor can, a family member might not. What does your heart say? Give yourself some grace and some credit. You have an identity. That's what he's talking about.
All right, great. Now,
I'm sorry. Go ahead.
Go ahead, Damian. I gotta let you speak. You missed so much tonight.
Yo, he's roasted the man. I mean, I understand. It's worth it. Being vulnerable. You can't be intimate without being vulnerable. And I think that people want the intimacy without crossing through the threshold of vulnerability. And depending on how much you reveal to this person that you're dating, it depends on how vulnerable you want to be with this person. However, if you want to be doing the horizontal mambo anyway, you need to be more vulnerable in the first place from the jump, so that as we get closer to that bridge, we can cross it in a way that makes myself comfortable and I am everything that I am. And then I can wholly be here in this moment because I'm not worried about something else, because I'm worried about what I'm going to do with you. And like, nah, we're here together. We're gonna have a good time right now. And that is the only thing that I'm focused on right now.
Good.
Okay. Is that you summing it all up for the night? Because I was going to ask you guys to sum up, so.
I think
keep going out. So
if you take anything away from it, I think the highlight of it was identity. I really do. What is your identity as a person who is living with MS? Also as a person, if you're the caretaker, what is your identity? That's a question that goes for everybody. What is your identity?
Be more vulnerable and do not be, don't feel a certain type of way if you need to, excuse me, be vulnerable and do something that you feel uncomfortable with. So if your voice is telling you to not say that thing, say that thing.
That's right.
If your natural tendency is to not do a certain thing a certain way, do something else. Because part of this whole human thing, one of the main reasons we're on this ride in the first place is choice. And every time that you choose to make the safe choice, and whatever that is, whether it's, oh, I'm not going to talk about this, oh, I'm not going to do this, there's no growth in there. There's no growth in safety. And so if you do the thing that is not safe, or the thing is, that is how you're going to grow, and that's how you're going to develop this relationship with this person that you're trying to do this intimate thing with anyway.
What you got, Stu? What you got?
What do I got? I got tired. Remember, I only had an hour of sleep last night.
Yeah, you got like 1 hour sleep, my guy.
All right. So what do I got is that, I first off, I wish that more people were online tonight. I do know that there are tremendous storms up the East Coast from Fred and from Henry coming in the other way. All right. We got tremendous fire season going on in the upper Midwest and the West, where, California, Oregon, the state of Washington, unfortunately, there's just a lot going on. And a lot of the people that do come onto our programs do come from these areas that are, being struck very badly the last few days. So, I am glad, though, that we are going to be able to, that this is being recorded, is going onto our YouTube channel. People will be able to watch on it. What I would like to ask the two of you is there a way that you think that we could put together a conference on these subjects and maybe get like a virtual roundtable going and get some other people in to the call? People that we think are vulnerable and that don't speak about this stuff. And let's get them onto our call to get them to open up about this stuff. And if we could show people, and if they themselves can find that there's comfort in speaking with us about it, maybe they can enlist somebody else, or they'll have the power then to turn around and say, I always thought that this was so freaking difficult, but let me tell you, man, it feels good when you open up. It feels great when you open up.
So weight left off. So weight left off the shoulders.
It changes your life, and again, it increases the relationship that you have with your partner that you're trying to be intimate with in the first place. It's real, man.
And it carries over. It'll carry over onto your job. It'll carry over into other relationships it'll carry over in the way that you approach people. Because for the first time, people have they want to put on facades, and you never really truly get to know the person you're actually talking to. Whereas for you, you are real. This is who I am. Take it or leave it. And you walk confidently in that. And watch this. You're going to find that more people, MS or not, they're going to wish that they could walk as confidently as you do. Indeed. For whatever reason, we don't walk in our own skin. It's crazy. Mm-hmm.
That's right. When I come back, I want to come back as a football player.
I don't know. That seems like a lot of icy hot and a lot of ice baths right there. I don't know.
No, hey.
Not only that, it's a pea cup on the sideline with a towel.
I'm coming back as a chef. Because I'll never go hungry, baby.
Y'all, it wouldn't be the MSV's the News program what I was doing, just letting you know what it is, baby.
That's right. All right, guys, thank you for doing this, all right? And whoever's online, I thank you for being here. I hope that you can share this with other people and tell them what they missed tonight, all right? But this will be on our YouTube channel. Oh, my God, I can't even say when. I'm behind by 6 or 7 videos right now from getting them on there. And hopefully that'll all be done in the next 5 days, all right? So we do hope to get this on here rather quickly. Tyler, thank you for being online. Damian, my blessings always to you for everything that you do. All right. Yeah, I could say namaste too. All right.
Right.
But if I hold up my hands, I see a lot of wrinkles. I don't like seeing them anymore.
That's your thing. You gotta get vulnerable about that and be like, no,
I need a tan. Come on, I'm not matching up here.
Well, then that's something else. And you live in Florida too. I got nothing else to say to you.
No excuses.
That's right. All right, everybody. Again, thanks. We got to sign off now. It's getting late. And thank you for everything. We'll speak soon. Tyler, go take care of the kid. or kids.
Kids.
Hey,
That's right.
thanks for watching, everybody. Thanks for
Damian,
tuning
go
in.
take care of your dog.
Say again?
Go take care of your dog.
Yeah. Well, thank you. And I will do that now. And thank you for holding this space for you and all of us watching. Well done, Stuart.
Thank you. Thank you. Thank you all. Have a great night.
Yeah. Good night, man.